Good morning, everybody, and thank you for this invitation. I am Dr. Devi Atukorallaya from College of Dentistry, University of Manitoba. I am an assistant professor at the Department of Oral Biology and a research scientist at the Children's Hospital Research Institute of Manitoba. My presentation is on oral health, and title for today's talk is Identification and Prevention of Common Oral Health Conditions. Our face is the most influential, attractive structure of our body, and good health around the orofacial region is very important. This presentation will give a brief overview on mouth and surrounding structures, tooth diseases, gum diseases, mucosal diseases, and jaw joint disorders. At the end, I will discuss about how to maintain good oral health with advancing age. Mouth is surrounded by facial muscles. Nasal cavity, eyes, and ears forms the roof of the mouth. Mouth opens to the throat where it connects to the respiratory and digestive system. Inside, the mouth has two sets of teeth, gums holding teeth to the upper and lower jaw bones, and mucosa as inner lining of tissues. Mouth is the key organ, which is important in tasting and processing food, articulating speech, respiration, and facial aesthetics. So first, I'm going to discuss about common tooth diseases. They can be the dental decay or dental caries, tooth discoloration, tooth wear, and tooth malalignment. Dental caries are caused by dental plaque. And let's see what is this dental plaque is. Inside the mouth, there are thousands of microorganisms, bacteria, viruses, and fungi. In addition, there are food particles and saliva. Over the time, these three substances forms a whitish, soft removable material, which is known as dental plaque. Now in this picture, you can see the newly formed dental plaque over the teeth. And this can be easily removed by proper brushing. But if not brushed properly, the plaque get accumulated and get hardened, and over the time, which is become the mineralized structures known as dental tartar. And this is very difficult to remove by brushing. The most common chronic tooth disease, which is induced by dental plaque, is known as dental decay or dental cavity formation. Eating and drinking foods high in sugar cause mouth bacteria to produce acid, and this acid can damage the tooth surfaces. Cavities can be at the enamel level, the dentine level, or at the root surfaces. They can cause pain, swelling, and spread of infection to the surrounding facial tissues. So how to prevent dental caries? Drinking fluoridated water, proper brushing and flossing can prevent the dental caries. Apart from the dental caries, tooth structures can be damaged by tooth wear due to acid reflux and mechanical wear. Sometimes tooth erosions can be due to the genetic disorders. Now, these are few examples where acids, mechanical like aggressive tooth brushing, and genetic conditions which increase the tooth wear. Tooth discoloration is another common tooth problem at the dentist office. Tooth malalignment, such as crowding of teeth and spacing of teeth, are most of the time related with our genetic makeup of tooth and jaw dimensions. Next, I'm going to talk about the gum diseases. Gums are important for the rigidity of tooth structures. Healthy gums can be defined as firm pink color gums, no bleeding or swelling, no plaque or tartar, and non-mobile tooth, with no root exposure and gum pockets less than 3 millimeters. The inflammatory diseases of the gums, bones that surround and support in the teeth, is known as gum disease or the periodontal disease. If not treated, the bone that support the teeth can be lost and the gums can get infected. Gum diseases are high among older adults and has direct link with systemic diseases such as stroke, cancer, respiratory diseases, heart disease, vascular diseases, and diabetes. Similar to caries, gum diseases can be easily prevented by brushing teeth twice a day for at least 2 minutes and flossing daily to remove the plaque. Healthy diet and avoiding tobacco intake and regular visit to the dentist, which helps in early diagnosis of gum diseases, are the most easiest ways to prevent the gum diseases. Next, we are going to talk about the diseases of the oral mucosa. Oral cancer is the most severe form of the mucosal lesions. Cancers of the mouth are primarily diagnosed in older adults, and one of the common cancers is of the body. Oral cancer can be identified by non-healing painful ulcers in the oral mucosa, red or white patches in the mouth or lips, pain during swallowing, sudden increase in tooth mobility, swelling in the orofacial tissues, numbness, and associated history, where the patient has a history of tobacco, betel quid, and smoking. Other mucosal conditions include oral ulceration, white and red lesions. These can be due to malignancies, infections, nutritional deficiencies, inflammatory diseases, and traumatic injuries. Early detection is key to increase the survival rate for the oral cancers. And oral cancers can be prevented by preventing high-risk behaviors and maintaining proper oral hygiene. Tooth diseases, gum diseases, mucosal conditions can lead to tooth loss. And this can adversely affect the individual facial profiles. The dentures and implants are alternative to natural teeth, which improves the facial aesthetic. They help to maintain full smile and help with eating and speaking. There are different types of dentures, full dentures, partial dentures. And it is important to rinse and brush the dentures regularly, and the regular dental visits are important to identify any pathologies associated with the dentures. The ill-fitting dentures can cause oral ulceration, growth of oral tissues, and sore mouth. Sometimes dentures can cause infections. Our upper and lower jaws are attached to each other by jaw joints, and this is the only mobile joint in the face, which is again important to maintain proper oral health. Pain or tenderness, difficulty in chewing or pain while chewing, facial pain, locking of the joint are signs of jaw disorders. Jaw disorders can be due to arthritis, jaw injuries, long-term grinding or clenching behaviors, and chronic inflammatory diseases. Increase in age can adversely affect our oral health due to the inability to maintain proper routine oral hygiene due to reduced tissue activities, increased wear and tear of the organs. Ultimately, these things can lead to gum disease, root caries, and maybe oral cancer. And advancing age has increased susceptibility to chronic diseases such as heart diseases, cardiovascular diseases, and diabetes. And there's a high incidence of dry mouth associated with the increased use of medications. But you can keep your teeth for your lifetime. Here are some things you can do to maintain healthy mouth and strong teeth. Drink fluoridated water and brush with fluoride toothpaste. Practice good oral hygiene. Brush teeth thoroughly twice a day and floss daily between the teeth to remove dental plaque. If you have diabetes, work to maintain control of the disease. If your medication causes dry mouth, ask your doctor for a different medication that may not cause this condition. If dry mouth cannot be avoided, drink plenty of water, chew sugarless gum, and avoid tobacco products and alcohol. See your doctor or dentist if you have sudden changes in taste and smell. When acting as a caregiver, help older individuals brush and floss their teeth if they are unable to perform these activities independently. Remember, good oral health is important no matter how old you are. Once again, thank you very much for this opportunity and thank you for your kind attention.